Hello and welcome to a new episode of Majlis podcast by Emirates Hospital Group. My name is 𝗠𝗷𝗶𝘀 and I'm a family medicine consultant at Emirates Specialty Hospital. Today is a great pleasure to have a colleague and a very good doctor, and also, I admit, I'm trying to get some personal advice from him without him knowing. Dr. Ibrahim, welcome.
Thank you for having me. It's great to be here.
Today we've decided to talk a bit about ACL. It's a common issue. We hear it a lot. People who are playing sports, they're always afraid that, I've torn my ACL. And you hear it. And actually, I think from your experience, I'm sure you hear it more often than what it is really the case. What are the main causes, in your experience, of ACL tears, and why are certain athletes more at risk to get ACL injuries rather than anything else?
Okay, so to start, the ACL or anterior cruciate ligament is a ligament at the center of the knee. And the main role of the ACL is to stabilize the knee in two motion. The first one is any rotatory instability of the knee. So the knee, the rotation isn't mainly on an external way, it stabilizes it. And the second stabilization of the knee is in the translation. And the translation of the leg bone in front of the thigh bone. So the ACL restrains the knee from having this kind of motion. So when do we see usually ACL tear? We see ACL tear mainly in people who play pivot exercise. And we say pivot, I mean exercise that demand a sudden change of direction, like football, basketball, ski. And then we have to differ between pivot contact and pivot non-contact. So pivot non-contact, ski exactly, when you have to go down a slope and change direction in a sudden way. There where the ACL plays an important role, and the increased risk is in pivot contact sports. So pivot contact sports like football, basketball, rugby, where on top of a sudden direction, you have the risk of a collision with another player.
I understand. So it could be also ACL and other injuries, of course.
Yeah, definitely. So why the athletes are an increased risk? The athletes are an increased risk because they're playing in sports that increase the risk of an ACL in a constant way. So when we talk about athletes, we're talking about season. So we're talking 30, 40 games a year. So the increased risk of ACL tear in people who play for a long period of time. So that can happen. But what are the main risks when ACL can happen? We can divide it into two. The first one is the unpredictable type of injuries. So let's say you're playing a game of football, you have your foot planted on the floor and somebody hit you. So this kind of things we can't control. The other type is the things we can control, which is people who play a long period of time. So they increase the strain on the knee and increase the risk of having an ACL tear. This is the type of things that we can control mainly, and that might increase the risk on the athletes. On top, there are certain risk factors that are increase the risk, basically sex. We know that female are at increased risk of having an ACL tear than male. And that there are a lot of theory about it, mainly hormonal balances, that the theory is that the ACL have some receptor related to female hormones on it, which might increase the risk. We know that female have increased knee laxity when we compare them to men. And also certain biomechanical issues mainly related to the jump landing mechanism. So when we jump, the way we land on our knee, if we land in an improper way, it might increase the strain and then increase the risk of an ACL tear.
Okay, fair enough, and that's very enlightening. Thank you. So another reason for me to be happy today about my gender is that technically I'm at less risk of ACL.
A little bit, not that much. Okay. So basically we're more, if you want, we see in absolute number more males that have an ACL tear, but relatively to sport. So for football, if we play the same kind of sport under the same condition, female athletes are more at risk than male.
Very interesting. Now, in a layman's word, if I may, and because you hear a lot of fears like, oh, I got a knock on my knee last night. I was playing football. Oh my God, I think I torn my ACL. What are the symptoms if I were a person, I am a person, but if I were just a player playing a sport, whether I'm new at it or I've been playing it for a long time, what are the symptoms that I should watch for, and when do you think I should really come and seek help?
So we're going to start with, like you said, in layman terms. So you're playing a game of football, suddenly you twist your knee and you hear a pop and you fell down. So usually that is followed after an hour. You feel like your knee is swollen up. So that the pop and the feel that the knee is swollen up mean that there's a risk that you have torn your ACL. But what differs in a game, let's say you twisted your knee, you hear a pop, you fell down. People who have an ACL tear usually don't tend to continue the game. They feel that their knee is not the same and they have to get out, which is different from people who have a sprain of the knee while playing. When they have a sprain, they fell down, then they get up, they try to play a little bit, but they feel their knee they're causing a lot of pain, so they're not able. ACL tear is a little bit different. Outside of very exceptional cases, people who have an ACL tear that's acute on the spot usually are get out of the game because they can't play. That differ a little bit when we talk about children. Children don't recognize a pop when it happens. So usually we don't see ACL tear in children directly in the clinic. We see them after 5 or 6 months because the parents notice that their children is lagging with other friends while playing sport. He's losing balance, he's falling down more. So the children can explain it properly as an adult, that the adult is gonna come and tell you that, yeah, I'm feeling my knee is giving away, it's shifting, I'm not able to do sport, it feels unstable. Children are a little bit different, so this is why there's a lag in acute cases. Of course, there are also chronic cases when someone had an ACL tear 3 years ago and he comes and see you. And he comes and see you because on a day-to-day he feels that his knee isn't holding him, so it's shifting, or because he's not able to do the sport that he wants to do.
Okay, fair enough. And that's a very nice point about the kids, which I didn't know. So it's good to keep in mind that in case of a child who's limping, as a parent, the child is not able to do the same exercise. It's not that maybe they don't want to do it anymore. Maybe we can just ask the question and then seek your expertise and say, well, is there something else that happened a few months ago?
Children go back to their exercise. The difference is that they lag. So they feel they're not able, the parents mainly observe that the child is not able to compete at the same level he was before spraining his knee, and then tends to ask questions, and on the exam you can notice it.
Which is then the role of the coach is very important then.
The role of?
The coach of the person.
Yeah, basically the coach, the parents,
Okay, very good. Now, of course, the big question is, okay, now I established the thing, I have ACL tear, I'm afraid of surgery, I've heard stories, I've done my research, I'm afraid of doing surgery, I hear a lot of failures. Surgery, not to surgery, what do you think?
So surgery, not surgery is a multi-factor question, basically. So it depends on a lot of factors. Mainly we talk about age. The younger the patient, the more important is to regain a stability of his knee. Because the younger the patient, he has a longer period of playing whatever exercise he wants to do. It's better to preserve the knee. Not having an ACL and doing exercise increase your risk of having subsequent sprain and give way episodes to the knee, which increase the risk of having meniscus injury, cartilage injury, and that increase the risk by itself of having early onset arthritis, which we try to limit. So basic first question is the age. How old is the patient? Is he young? Is he old? Second question is what type of exercise he do. So let's say, for example, you're seeing a 45-year-old patient in the clinic who torn his knee with a freak accident at home, and he just, as exercise, he does swimming, jogging, non-pivot exercise. So basically, in non-pivot exercise, we don't use our ACL as much. So ACL doesn't play a big role in non-pivot, like swimming, swimming, bike, going up, down stairs, jogging. So in these cases, we tend to go in non-conservative way. Non-conservative way mean physiotherapy, quad strengthening. Quad is the quadriceps, which is the main muscle at the front of the thigh that plays an important role as a stabilizer of the knee. And we go a non-conservative route to see if the knee is able to stay stable on a day-to-day activity. Certain people become stable and they don't need to do a surgery and they go a non-conservative route. And some people still feel on a day-to-day that the knee shifts and they're not able to maintain a daily activity without being bothered by their knee, and then surgery become an option. But in younger patient, usually most of the patient require surgery. Like I said, a lot of sports, they're still young, they have a whole career in front of them, so you need to maintain a certain stability to the knee.
I'm listening, and then my biggest fear was when you called the 45-year-old a bit old.
Yeah.
So I was trying to see what more damage
No,
I'm
basically-
getting my way. But
Yeah. Basically, it's a threshold.
Yeah.
They're the threshold of an age. So, for example, same age 45-year-old with a freak accident that does ski and want to continue to do ski, that's a very good candidate to have an ACL reconstruction.
No, I'm just kidding about the
Yeah,
age,
yeah.
but I've embraced my age, so I'm in better
Yeah,
place
but
now.
yeah, like I said, it's multifactorial based on age, type of sports. A lot of things plays into it.
So you hear stories about saying, no, it's better if you want to go the surgery, go early, than whereas if it's a chronic injury, then some people say then it's you don't want to lose the time frame of the. Again, what do you think in terms of, is there pushing, like if I've decided that I want surgery but I want to wait, is there a time frame that I shouldn't wait beyond or not really?
So basically, the thinking is that we should treat recreational athletes as professional athletes. So professional athletes tend to have surgery within a week of their injury, a week or two, basically. If you follow up on ACL injury in professional athletes, either in football or rugby.
Okay.
But in recreational athletes mainly, all of studies have shown that a certain delay between injury and surgery is a very good indicator for graft remodeling and decrease the risk of injury later on. Why? Because once we have the injury, the knee stops to function properly, and the main muscle, which is the quadricep, stop contracting properly. And when the quadricep stop contracting properly, we start to lose our extension, our ability to completely open our knee and not be able to contract our quadriceps properly. And going into surgery with this kind of lack of quadriceps activity is one of the biggest predictive factor of having complication our rehab and increasing the risk of reoperation later on and re-injury. So what's the best timing? Usually the timing for me personally is when I see a good quadriceps contraction. I mean, the patient is able to contract his quad back properly. He's able to have a full extension. Basically, he's around 80 to 90% when we compare it to the other quadriceps. And we're able to see a good locking mechanism of his quadriceps. That is for me the timing where, we need to go to surgery. Doing the surgery very early can cause a lot of problem after the surgery in the rehab phase for the patient.
Okay, thank you, and that's a very good point. And because you mentioned the tendons, that will bring me now to the next question. And you mentioned the quads, so the tendons there. The type of surgery, you hear people saying patella, you hear people saying from the hamstrings. Is there a difference? What is your approach, and what is the evidence?
Yeah, so basically, while using the technical term, when we do the surgery, basically we can either use an autograft. Autograft means harvesting a tendon from the patient's body, or using an allograft, which means taking a tendon from a cadaver. Usually, the younger the patient, we tend to go with an autograft, mean harvesting a tendon from his body, because most of the study have shown that taking a cadaver tendon in a young patient increase the risk of failure 3 to 4 times.
I see.
So in younger patient, we tend to go an autograft. When we talk autograft, there's a lot of option on the table. We can either use a hamstring, which is the tendon at the back of the thigh, or we can use a patella, or we can use the quadriceps, which are the tendon on the front of the knee. Which one is better? This has become a little bit nuanced based on what type of exercise, the sex. Some studies have shown that patellar tendon works better in female athletes than hamstring tendon. But usually the failure rate of the tendon is pretty comparable between the three. So usually it's more a dealer choice than anything else. Myself personally, I tend to go for a hamstring tendon as first. The idea mainly for me, it's less morbidity side than other tendon, easier to harvest and to use. And obviously you have other tendon to use in case of re-injury, or you're trying to go for what we call a revision ACL reconstruction.
Fair enough. And again, thank you very much. And that's, I guess, for our audience, very important point, because I'm sure whenever someone has their ACL torn, they are torn kind of in their decision and doing their own research. And there's a lot of difference between this doctor or that doctor seeking multiple opinions. So really it's a combination, it's a combined decision between the patient and the surgeon, and then
Yeah,
to reach
definitely.
the best option for each different case.
Yeah, definitely. So, yeah, basically, even when we do ACL reconstruction, we need to tell the patient beforehand that there is a failure rate of our reconstruction that tend around 7 to 10%, that the patient might re-tear his reconstructed ACL. And even in these cases, what we try to do is to reinforce our ACL with a tenodesis. And what I mean by tenodesis is add an extra ligament, an extra reconstruction on the outside of the knee, which helps the ACL control the rotational part of the knee. And that's very important because studies have shown that this kind of reinforcement of ACL decreases the rate of failure to less than 5%, which is very important.
Now, I'll make the question a bit more personal because I've been through the ACL torn and then all the tendons. And there's always that blame game internally. So like, I should have done that before I went there that day, before that injury. What is your advice, not now that I'm someone seeking your help because I've torn the ACL, could I do as a recreational athlete in my 40s and my late 30s? What can I do to prevent or reduce the risk of the ACL in terms of workout? And then I know you mentioned depending on the sports, but in general as a kind of preventive measures.
So like we talked at the first, there is a risk factor that's outside our ability to control it, but there are risk factors that we can control. So basically, what can we control? What we control is the risk factor that might increase the risk of injury. So we talked about a high load of games. So when you try to play for a whole season, 40 to 50 games, rest becomes very important for the muscle. The more you play, the more your muscle at a risk of collapse, the more you put strain on the knee. So rest is very important. In children specifically, because we tend to have, we're seeing a higher trend of children playing more and more competitive sports. And studies have shown that children that play multiple sports usually are at less of a risk of having injury than children that play one sport. Because multiple sports allow the muscles and the children to rest in a dynamic way. The third thing most important is preconditioning, or conditioning if you want, and basically core workout and core stability. There's a lot of programs out there that have been proven by studies that are successful to decrease the risk of injury. To give example, FIFA 11 program, which is online for free for everyone. FIFA 11 have shown to decrease risk of injury around the knee by up to 40%. So conditioning, core training, trying to strengthen the quadriceps muscle and relative to the hamstring, which are the muscle at the front of the thigh and the back of the thigh, which play an important role as a stabilizer of the knee. So all of that together plays an important role. Also, we talk biomechanically about the landing mechanism, working on having proper landing, working on the stability, single hop test, double hop test, which you see with physiotherapist or your coach. All of this are preventive risk factor. When you work on that, you will decrease the risk of having an ACL injury.
Thank you again. That's very valuable. I think these preventive measures and then the workout that you said available online for free. I'm sure our audience hopefully will look it up and then start applying it themselves and on their children. Now, again, I'll take it to myself now in my case. And I've always said it. When I hurt myself, I wanted the best surgeon, and it was the ski season, so many people at the time were injuring their knees, unfortunately. So I picked my surgeon based on that criteria, and he is a surgeon who would do many of these surgeries. The human instinct, I wanted the best of the best, and kind of the whole scenario. I always admit, I said, I cannot blame the surgeon, I blame the patient. I didn't do my rehab. I've done part of it, then life kicked in, work came in, and then I forgot my rehab. Where is the role of rehab? I know you mentioned it briefly earlier. So after the surgery went well. I'm eager to recover. I want to go back to sports. I want to go back to work. What is your advice after the surgery?
So basically, rehab after an ACL surgery is as integral as the surgery itself. So usually studies have shown, we talked about the period between the injury and the surgery, how much is delayed. Delaying the return to sport is as important. Studies have shown when we delay return to sport up to 9 to 12 months, we will have better result later on. So we see patient or even doctor trying to encourage an early return to sport. Usually this is what the thinking was many years ago, but that changed with new studies have showing that the more we delay our return to sport, the better result we will have a long run. And specifically, the better result we will have in something we call graft remodeling, which means once we've done our reconstruction of the ACL, we've done a new graft, we need to give the graft time to remodel and reintegrate itself inside of the knee. So the longer we give it time to reintegrate itself properly inside the knee, the better result we will have at the long term. So, but to start with the rehab, basically the rehab should start around 2 weeks after surgery. For me, usually I try to give the patient a week, 10 days of rest, and then he can start his physio or rehab. Basically, rehab shouldn't be that aggressive. Once or twice a week should be enough. Usually, like we talked, first step is always to reactivate our quad and have a good contraction of our quadriceps, and then you follow up with everything else. An important factor to pay attention to is the psychological factor. Okay, we treat patient, we don't treat knees. So a patient psychological factor at return to sport is a very important, and studies have shown being psychologically ready on top of being physically ready is a very predictive measure of how the patient is gonna progress after years and years. So there's a lot of tests to do during the rehab to show the psychological readiness, to show how much the knee is ready based on the stability exercise, plyometrics, and a lot of that. A rehab specialist would be better than me than answering those. But yeah, a lot of things plays a role, and psychological factor plays an important role as much as rehab before we go back to sport. But delaying it as much as possible, up to a year, is very important.
And thank you for highlighting this, because again, if I draw from my experience, I think the first surgeon that I avoided was the person who told me you should pick a sport that's appropriate for your age, rather than ask me what I want to do and where I want to be, whether in my rehab or from my surgical perspective. Dr. Ibrahim, I could keep you here for hours. We can talk more joints, but I think for today's episode, I think we reached kind of the end of today's topic. Any last minute or any last message we want to kind of share today with our audience?
Basically, joint health, knee health in specific is very important. Conditioning ourselves, stretching ourselves, being able to do sport at the highest level demand for us to take care of ourselves before anything else. So let's condition ourselves properly. Let's pay attention to our muscles, stretch properly before we do any exercise, at least to limit the injuries as much as possible.
Dr. Ibrahim Haidar, our orthopedic specialist at Motor City branch. Thank you very much for being with us. And this brings us to the end of today's episode at Al Majlis podcast by Emirates Health Group. Please stay tuned for further episodes soon. Thank you.
Thank you.